Okay, so we're recording. So welcome to the ISAG, not a podcast, but a video. I'm Julian Mercil, and I'm joined by Anthony O'Connor, who is a consultant at Tallaght Hospital. Some of you may know him because he's active on social media, of course, and a couple of days ago, he talked about on Twitter about how the situation in the hospitals was really bad. And he got something like 20,000 likes and 5,000 retweets, which must be the world record in Irish current affairs. So we have him today to talk about that. A lot of people are complaining about, the vaccine, for example, the situation in the hospitals, but it's a little hard to know who's right and wrong unless you have someone in the hospitals who knows what the situation is. So Anthony, welcome. And
thanks, Julian.
I'll start with this. Can you tell us what the situation is in hospitals right now? We all know, we all think about Bergamo, the hospitals overflowing. We can read the papers, but for someone who's not working in a hospital, it might be a little difficult to know exactly what's going on and how it's different from normal non-COVID situations.
So we're under extreme strain at the moment, Julian. I suppose the difference we're seeing between sort of now and a non-COVID situation really is in, I suppose, how sick people can get and how quickly people can get sick and how much oxygen they require. Certainly, it's been very sort of sobering over the last couple of weeks, seeing people who are, maybe in their late 50s, early 60s, who previously were fine up until a few days ago, exercising and playing golf and things like that. Really being in mortal danger and requiring life support within a number of days. And to be honest with you, that's been more pronounced on this occasion than it was last time. I think the overcrowding in the intensive care units has been greater on this occasion as well. What we're seeing is operating theatres have now been closed, so there's only the absolute emergency surgery is able to take place, and the operating theatres, which would normally have surgery going in them, now might have 2 or 3 patients on life support machines in them. We struggle at the best of times with isolation capacity, but now we've got a situation where lots of hospitals are seeing huge numbers of patients with COVID-19 and don't necessarily have the single rooms and isolation facilities to easily cope with that. We're seeing a lot more staff out sick on this occasion than we saw previously, and that creates its own problems as well. There are thousands of health service staff who are out sick at the moment, either as COVID cases or close contacts. So, what we're dealing with really is the perfect storm in terms of the number of cases, the acuity of the cases, i.e. how sick people are, and the impact it's having on our staff. So it's a moment of extreme strain in the life of the health service.
And so you were saying it's worse than the first time. So what's if I was asking you, well, how can we make this better? What's the key things that should change?
I think, unfortunately, for the next 2 or 3 weeks, the die is cast. So, what's going to be keeping us busy in the hospital over the next month, really, is things that have already happened, people who've already acquired the virus, people who are currently incubating it or are in early stages of their illness, or the people who've just come in who are going to deteriorate. This is not a disease that people bounce back from very quickly when they're very unwell. They tend to take very long times in ICU. So for instance, we'll say a normal sort of season where people have chest infections, we might see people who get very sick and require intensive care, but within 3 or 4 days, they may turn around and be discharged to a sort of a lower level of care on the ward. What we're seeing with the COVID-19 patients is they're staying in intensive care for a very long time. It's very hard physical work for the intensivists. Our intensivists are absolutely brilliant. Our survival rates in ICU are among the best in the world for the first wave. We used ICU care very judiciously and we're very smart about it. And the survival rates really were absolutely first class. But on this occasion now, our intensivist colleagues, who really are the ones who are absolutely bearing the brunt of this from a health service point of view. I mean, when I say intensivists, I don't just mean doctors. I mean nurses, physiotherapists, care assistants and porters, and everybody who's involved in the intensive care setup are really under, again, now unprecedented stress. And the thing to remember is the first wave, we were in the brace position. We had about 3 or 4 weeks to get people cleared out of the hospital, to sort of have an orderly wind down of the hospital's general activity. You'll remember that everything started closing down last time from March, and then it really hit us in early April. What we're seeing on this occasion now really is we went from 0 to 60 over the course of about a week. So there's a lot of catching up to do there. It's been extremely difficult. And
so, I mean, I imagine that the stress levels and anxiety among doctors like you or nurses, it must be really, really high. Like, are people breaking down in some way? Like, I can, after a year, it must be like, did you get used to it, or is it just getting worse? Or
there's huge fatigue, there's huge anxiety. What I would say though is that, I think everybody in the country possibly feels a little bit helpless at the moment, and that maybe there's not a lot they can do. And I think one way in that we're lucky as healthcare workers, my wife's a healthcare worker as well, is that we can do something about this in a very real and practical sense. And I think that's actually good for one's mental health as well, in a way that you don't feel so powerless over the situation, that simply by going in and doing what your job is and what you're trained to do, that you can play a very meaningful role in how we fight this. But certainly, yeah, I mean, the people I really feel sorry for again are the intensive care workers, who are the strain that they're describing is very difficult for me to convey to you. And they are exhausted, and we're all exhausted, really. But those guys are literally, they're pouring from an empty jug at the moment, and over the course of the next 3 weeks, I think it's broadly accepted that things are definitely going to get worse before they get better.
And what kind of shifts do they have, either people like yourself or the people in intensive care? Is it like 7 days a week, or is it 12-hour shifts, or how does it work?
I think I've been in the last 8 days in a row anyway, and probably I think I'm off next Sunday. But the shifts are what they demand. Sometimes they're very long days. We're all trying to give a hand with the vaccination rollout as well, which sort of adds to it. There might be days where you could wrap up a bit early or work from home a bit. We do all have sort of hospital laptops now where we can do that, and that's good, in particular with the idea of children being at home and homeschooling as well. But really, the hours are very long. I think most people are probably clocking at least 60 at the moment, at my grade at least anyway. The people I think who have been very much unsung heroes during this as well are the young doctors, the doctors in training, specialist registrars and things. I was on call in our hospital over the weekend, and really, really difficult and challenging period. But the quality of the younger doctors working with me was absolutely remarkable, and we are incredibly fortunate to have that. But look, I suppose people's tolerance will only go so far, and I think one of the things that we have to make happen is that this is the last wave, this is the last lockdown. This shouldn't have happened, in my opinion. Now, who knows, given the seasonality of the virus, if we would have had something like this anyway, but it needn't have been as bad as this. And I think we have a real choice now to make as a society as to whether or not we end up back in a situation like this.
Are healthcare workers in hospitals, are they angry at the government for not fixing this, or is it more a feeling of, well, that's what it is, or what's the mood out there?
Well, I suppose there'd be a range of opinions, and I think it would definitely be fair to say that anger and frustration is one of them. It's very difficult. A lot of people in healthcare are also married to other people in healthcare, including myself, and it's very difficult to, every instruction everybody gets is to spend as much time at home as possible and work from home and do this at home and do that at home. But when your job demands presence so much of the time, and you might have two parents in the one family who are like that, then that's a real source of frustration. You know, to be honest, I kind of feel a little bit like we were thrown under the bus, and our children have been thrown under the bus. You know, you know, children of healthcare workers. It's very difficult for us to do the homeschooling thing when you get in after spending 12 hours in the hospital, and the kids have been with the minder, and they can't. And it's hard for them to concentrate, and they're excited to see you, and they're tired, and you're all trying to get through 3 hours of schoolwork. It's extremely difficult, and I think you know, certainly the children of healthcare workers are having a particular suffering when it comes to their education.
You mentioned the vaccine that you were trying to help as well, to pitch in. A lot of talk about that again. A lot of people are complaining or frustrating that the rollout is not happening fast enough. I know David McWilliams had a chart of slowness or whatever, and he got a lot of attention on Twitter. Can you tell us, in your view, why is it taking longer than it could be? Is it because the HSC is not doing its job? Is it a supply problem? Is it something else? Because people seem to be complaining a lot, but the answers are a bit elusive.
I think it's important to keep a broad perspective on what the vaccine is, what it'll do for us, and more importantly, what it won't do for us. Now, there's 200 countries in the world, and only about 40 of them have had vaccines. So first of all, we're in an extraordinary privileged position that we're able to give vaccines. I've been helping give some vaccines at my place of work. Last vaccines I gave were in a mountaintop school in Kenya about 15 years ago, you know. So I think I have a perspective on vaccination, what it means in a global sense. I think if you look at the infrastructure of public health in Ireland, and when I say that, I don't mean the public healthcare or public hospital system. I mean public health as a discipline around disease prevention and suppression. Our public health infrastructure is very weak. We have chosen not to invest in it. We have chosen not to empower specialist doctors, consultant doctors at the public health grade, and we don't have proper teams. So these are the people that run vaccination programs. And I think sometimes when I hear commentary from let's say, people involved in finance and economics, they seem to think it's almost like Deliveroo or something like that. There should be somebody riding around to your house in a moped with a vaccine. I mean, the Pfizer vaccine in particular probably shouldn't even be carried upstairs. That's how delicate it is. Like it needs to be stored at -80, delivered over 2 doses. It's not simple. And it is a quasi-experimental thing insofar. Obviously, it's been trialed a lot, but it has come to market quickly, so we've got to be careful about how we use it. Now, at the moment, we're about 13th in the EU, so we're roughly mid-table in terms of our vaccine rollout. And I think we're achieving that with a set of public health resources that would be bottom of the EU table. So we're probably punching slightly above our weight. I can understand why people are frustrated, and they cite examples like Israel, where people are getting the vaccines out very, very quickly. I think we can only really fairly be compared to other EU countries, and we're about middle of the road with poor infrastructure. So I'm not sure how much better it could be. It seems to be ramping up, it seems to be getting faster, and we need to keep the pressure on them to do that. But people need to be realistic as well, in that if there was a vaccine, a one-dose vaccine that, you know, you could drink as a lump of sugar in everybody's letterbox in the morning, we would still be in the absolute horrors of this disease for the next 6 weeks. So there's an immediate term that needs to be addressed as a priority. I think, you know, the vaccine rollout I think it's far too early to judge that. And what I will be looking at is the trend of how much faster we can go, where we're at relative to our European counterparts. We've got to be realistic. We let public health go to rack and ruin in Ireland as a specialty. And, you know, people who had absolutely nothing to say about this for the last 15 years now seem to be experts on that we're not getting the vaccine rolled out quickly enough. So that's a source of frustration for those of us who are involved in medicine. But look, it seems to be getting faster. Let's see it get faster again. It is our ticket out of this. You know, there is a short and medium term challenge to be addressed even independently of the vaccine. and restrictions aren't going away in you know, your restrictions. I've had my first dose, and your restrictions don't go away as soon as you've had your vaccine. It takes a long time after that. So vaccines are part of the response, but I think sometimes in this, what frustrates me is people focus too much on a thing. They'll say, oh, well, we need to get testing right, or oh, we need to get contact tracing right, oh, we need to get vaccination right. Actually, you need a package. You need to be doing everything, and that's where having a strong, robust public health infrastructure comes into place. That you can, you know, you've got teams on the ground that can respond aggressively to outbreaks. You've got a vaccination system that's tried and tested over many years, ready to go. You've got the human resource to do it. You've got the IT resource to do it. And we were coming from a place where we had almost none of those due to choices we made around investment. They've tried their best to catch up in the last few months, but there's a lot of this is chickens coming home to roost from 15 years or so, rather than something that can be fixed overnight if we just, you know, go with whatever the latest fad or the latest celebrity commentator is. You know, it is not that simple.
So last question before I let you go. When do you think we'll be back to normality? Everybody's wondering.
Very good question. I mean, I'd be optimistic that, you know, some semblance of normality might have returned to most of our lives, you know, by midsummer. Hopefully by this time next year, hopefully we're back to it. But there's so much. Look, this time last year, you know, I can remember hearing about this disease for the first time on my birthday last year, which is the 24th of January, you know, and so much has happened since then. It's difficult to look too far out into the future. But look, if we go for aggressive suppression measures, if we roll out a vaccine, and if, you know, if we support our healthcare system enough to ride out these next 5 or 6 weeks, then yeah, hopefully we could have a meaningful summer, even if not quite normal. But it's a choice. I think it is a choice, and I think aggressive suppression of the virus is the backbone of that choice. I think, and I think it's beyond time that we did it. It's the only human rights and equality-based approach to this problem.
Okay, thanks so much, Anthony. Thanks for the interview, and thanks for your work in the hospitals.
Thank you, Julian. Thanks for the work with ISAG. It's absolutely brilliant. It's great to see.